This is a pharmacy, probably something you're used to seeing and the first thing you think about when I mention the word pharmacist. But what if I told you a pharmacist has a bigger role than just working at a brick and mortar, like this one, or this one, or this one? Those familiar aisles, the prescription counter in the back, the face behind the glass that hands you your medications. But beyond that lies a hidden world of healthcare few understand. While you see pharmacists counting pills and checking prescriptions, here at Desert Oasis Healthcare, they're medical detectives, drug safety experts, and a crucial bridge between you and your doctor. They spot dangerous drug interactions. They even help develop the drugs of tomorrow. What you don't know about your pharmacist could save your life. We're going to talk now about what really happens when those white coats go to work. To understand more about pharmacists, we should talk a little about their history. Over the last 4,000 years, we've seen a significant evolution in the world of pharmacy. From days in the ancient past when prescriptions were recorded on a clay tablet in Mesopotamia, to today, where pharmacy is highly specialized with an advanced patient-focused foundation. Experts say, though, there is still progress that needs to be made. In order to understand what lies ahead in the future, let's start by taking a look at the past.
Lindsay, the history of pharmacy is fascinating, dating back thousands and thousands of years. Take us to the origin story. What can you tell us?
Well, it goes back, like you said, about 4,000 years to the Egyptians. We actually have ancient tablets that tell us about the original pharmacists taking medicinal plants from the natural world and applying them to health for the community.
This was an integral part of society and the community back then, at that point.
Oh, absolutely. These were people that were trusted by the community. They knew where to find these medicinal agents and how to prepare them.
Flash forward to, let's say, the 50s. There was a point, and I found this interesting to learn, that it wasn't as specialized as it was now. A doctor and a pharmacy, they kind of all did the same thing. Can you explain that a bit?
Yeah, we can even go back further than that to the 18th century, where physicians and pharmacists were one and the same. And that's the point at which they started to diverge and become two different professions. When you think of the healthcare system, it's really complicated. And you have the physician who's really understanding the diagnosis, the body's systems, and helping to determine what disease is there. And then you have the pharmacists who have access to all the information about medications, how they work together, how they might not work together, how they work in different body systems. And so to have those two areas be so specialized offers our patients so much more.
It seems that people traditionally have, that relationship with their primary care physician, not with a pharmacist, so to speak, right? But have you seen these situations where people do have those relationships with the people that obviously own, are in charge of the medicine? That's such an important aspect of their healthcare. Is there a connection there?
There is. Pharmacists are just very accessible.
Right.
When you look at the number of pharmacies in the US and access that people have to them, there's more pharmacies than Starbucks.
It's crazy to think. I mean, right everywhere you turn, there's a Starbucks, but that just shows how many pharmacists are really out there in our communities.
They're there, they're available, they're constantly behind the counter, ready for questions, and that's our bread and butter. Talking to patients, giving them advice, helping them understand their medications. And as time moved on and we gained a little bit more of an ability to manage patients at the pharmacy level, we start to see things like vaccinations happening. And pharmacists are actually the #1 vaccinators in the country.
Our department is called PHARM, but it's Population Health and Prescription, which is the little RX symbol, management. When I started at Desert Oasis way back in 2005, I was the first pharmacist, so seeing the team as it's developed today is really like seeing a dream come true. But all of this was about helping people make sure that with a medication that had such value, it started with anticoagulant medication. Many people know if they've been taking Coumadin or warfarin, many people take this medication. That was the first thing we started working on because there was a narrow window between what was beneficial for you in preventing stroke and then also the adverse effect, which is a risk of bleeding. We started with one collaborative practice agreement that we were working on with anticoagulation. And what was great with that is there became more attention on the notion that not controlling your chronic condition really leads to a lot of issues for patients. So a lot of hospitalizations that can be prevented, a lot of deaths that could be prevented. So we started to look at what are other conditions that aren't being controlled as well, that perhaps some help with a pharmacist in between doctor visits could be helpful. So the next part of that was diabetes and hypertension, hyperlipidemia. Those were the three elements that our physicians started to say, well, if the pharmacists are helping with anticoagulation, maybe there's more they could help with diabetes. And talking about access, at Desert Oasis, we are working as a team with our physicians, a deep investment in this. We have over 30 pharmacists working on our team, so it's a very huge benefit to our members. But these things are happening, all over the country, and your pharmacists, accessible 5 minutes away, as Lindsay said, there's more pharmacies than Starbucks. They are the most accessible healthcare professional, and that's part of what a lot of our pharmacists are in advocacy, that making sure that people have access to that expertise, because they can do a lot to help patients that might not be being realized in other places as much.
Pharmacists play a critical role in the healthcare system by ensuring patients use medication safely. While prescriptions can save and change people's lives, responsible and informed use is imperative because it can not only prevent negative side effects, but it often can mean the difference between life and death. Pharmacist-patient relationships are more important than ever before because knowledge is power, and while they manage and monitor your medication plans, pharmacists can also provide significant education to help you achieve your health goals.
It's exciting to get to talk to you to learn more about what pharmacists do on a day-to-day basis. I know it's so important. I'd like to start with what events lead a patient to eventually being referred to a pharmacist?
Right, yeah, and at Desert Oasis, we're pretty unique because we have a lot of pharmacist-led clinics, which offer specialized care to those patients who are at the highest risk. So in terms of being referred, those are the patients we're getting. That's our patient population. These are patients with a lot of comorbidities or a lot of medical conditions that put them at high risk for getting really sick, going to the hospital. So that's kind of where it all starts. We have a patient who maybe has tried a couple things, but their condition isn't controlled, and so they need additional help, and so they get referred to our pharmacist clinics.
Patients are generally referred to us when they have complex or chronic disease states which need to be actively managed more intensely. So, for example, for a patient who has diabetes, the physician or the primary care physician will diagnose their diabetes and start treating the diabetes. But diabetes is a progressive disease, which means it's always getting a little bit worse. At a certain point, that patient's going to need more intense or more active management, and that's when the patient will be referred to us to take over that care.
Patients who have multiple conditions, which subsequently, I presume, often means multiple prescriptions as well. It's a lot to manage. Talk about that.
Exactly. So that's where the role of the pharmacist really adds a unique spin or value to it. Is we know how to what medications are used for what, but beyond that, there's also the aspect of dosing.
I understand it might seem common sense, but truly understanding your correct dosage of medication could mean the difference between life and death, right?
Yeah, exactly. There's so many aspects to figuring out the right dose. So for one, the first thing you have to think about is for this specific condition or indication that we're using the medication for, what is the correct dosing? That's, I guess, the first thing you need to figure out. And then beyond that, you have to look at other factors. Is this appropriate for their age? Do we need to adjust it? Are they older? Are they younger? How about their kidneys or their livers? What's that like? Because that can affect how medications are cleared. And so based off that, you would need to adjust the dosing.
Especially with certain medications that I deal with for diabetes. So for example, insulin. A patient accidentally takes too much insulin or takes an incorrect dose of insulin, that can cause low blood sugars. They could end up in the hospital. They could possibly even die, right? So medication dosage, making sure the patient understands what to do if there's any kind of issue with their dosage or they're not sure what to take, being accessible to that patient so they can always call in if there's any questions is very, very important.
I understand the pharm department is this big umbrella under which there's many different clinics. Can you explain that puzzle, if you will, and where you fit in?
Yeah. So you're right. It's an umbrella term. We have a lot of different clinics that, again, are pharmacist-led. Just to name a few, we have like a diabetes clinic, a pulmonary clinic, which deals with the lungs. We have anticoagulation, which is like blood thinners, and of course, cardiac. Just to name a few. For me, I specifically work in a migraine clinic. So that's where my niche is. That's my specialty. So the patients that are referred to me, they're the ones that are suffering from debilitating migraines, and they just need the extra help. They've tried a few things and just don't know where to go.
When you meet with patients, they get a good amount of time with you, yes?
Oh, yeah. So that's another benefit of pharmacists,
Yes.
Accessibility. That's kind of the way, at least I see myself, much more accessible, whether that's through follow-up calls. But let's say for what you're talking about here, appointments, our appointments can be, it involves education, talking about medication. So that can be, 30, 45, sometimes for me, an hour or more. Just depends on, all the questions the patient has or what's going on with them. And I can't tell you how many times I heard a patient thank me and say, oh, wow, no one's ever been through or discussed all of this information to this level with me. So, it goes a long way.
I have some patients who I speak with weekly. I have some patients who I speak with every 2 weeks, every 4 weeks. It really depends on what that patient needs. And patients are always aware that they can call in and speak to a pharmacist 24/7.
Can you explain the difference between a pharmacist at a Rite Aid or a Walgreens and the pharmacists here at Desert Oasis Healthcare?
Sure, yeah. The pharmacists you see at the big chain pharmacies, Rite Aid, CVS, Walgreens, we call that setting community pharmacy. That's kind of the traditional role. What you see there, their primary role there is to verify orders, make sure it's appropriate in terms of dosing, drug interactions, and to dispense and educate the patient on that medication. So that's the primary role. With pharmacists at Desert Oasis, I would say we're called ambulatory care pharmacists. That's kind of our label, if you want to call it that. But what that means is we operate under collaborative practice agreements with our supervisors, medical directors, and are able to, in a sense, we have some autonomy to prescribe, order labs, increase dose, change the dose, stop a medication. This is all under the protocol that we've all agreed on. So that's kind of the difference. We are actively managing a patient's disease. We are actively prescribing and adjusting the medications and doing the adequate follow-up in terms of appointments and also lab work.
From a quick prescription pickup at your local pharmacy to in-depth conversations to help manage multiple prescriptions and doses, pharmacists play a pivotal role in the healthcare system. Yet you may be surprised to learn that pharmacists are missing a crucial recognition from the federal government. Let's take a deep dive into what potential policy change could mean for pharmacists and for all of you at home.
Thank you, Dr. Chen, for being here with us today. We're really, in this episode of The Pulse, trying to focus on and open people's eyes to the importance of pharmacy and understanding it as a whole. We've talked about the history, and I want to talk to you a bit about the future. I'd like to start with, it seems from what I've heard, pharmacy has come a long way. I know there's a lot more that needs to happen, but when you look back, what are you most proud of? What has been the biggest change that is beneficial to the current state of pharmacy?
Gosh, that's a tough question. I've been in practice over 30 years. When I got out of school, I was told, well, any year now, pharmacists are going to get federal provider status. 30 years later, we're not there yet. Wow. So to your point, there has been progress, right? At least the states have passed legislation, not all, but most, that allows pharmacists to do more with the healthcare team and help patients directly. So I'd say that's progress. There are other states that have something called payment parity laws, where pharmacists providing care under certain circumstances in the outpatient setting must be paid by health plans. So we're moving along in that direction where there's recognition of some value in certain states and some support for getting pharmacists where they should be, which is in front of patients, working with them directly to improve their health outcomes.
What is the gap, though? And explain this, if you can, in layman's terms for people who aren't a part of the industry, myself included. Pharmacists are not covered under what? And right? I mean, I think that's news to a lot of people.
It is interesting. So if you think about everyone in your mind that you think is a healthcare professional, right? Nurses, physicians, of course. Well, let's see. You can go through social workers, nutritionists, PTs, physical therapists. They're all recognized as providers by the federal government. Only pharmacists are not recognized as providers by the federal government. And you're probably wondering, well, why is that? I can't explain that. I just know that maybe 60, 70 plus years ago, pharmacy just wasn't at the table when provider status was designated for different health professions. And since then, it's been nearly impossible to get that covered. Now, does that make sense? Again, at the end of the day, if you're not a provider, that means a health plan or someone that pays for healthcare has no direct channel to deem you a billable entity. So in other words, you can't be paid when you provide clinical services. Now, before you think, well, pharmacists don't have to be paid, they make money on the medications. Today, pharmacies struggle to stay open because, believe it or not, there are many medications they dispense for which they lose money on every one of those medications. It's a different environment today than it was 30, 40, 50 years ago. So while pharmacists may have had more time to educate, counsel, et cetera, their time is so limited because they're just trying to get by day to day in terms of just getting their prescriptions out there and keeping the doors open.
Pharmacy has come a long way. I know there's a lot more that needs to happen, but when you look back, what are you most proud of? What has been the biggest change that is beneficial to the current state of pharmacy?
Gosh, that's a tough question. I've been in practice over 30 years. When I got out of school, I was told, well, any year now, pharmacists are going to get federal provider status. 30 years later, we're not there yet. Wow. So to your point, there has been progress, right? At least the states have passed legislation, not all, but most, that allows pharmacists to do more with the healthcare team and help patients directly. So I'd say that's progress. There are other states that have something called payment parity laws, where pharmacists providing care under certain circumstances in the outpatient setting must be paid by health plans. So we're moving along in that direction where there's recognition of some value in certain states and some support for getting pharmacists where they should be, which is in front of patients, working with them directly to improve their health outcomes.
I know, just reading about your work, you participate in a lot of grant-funded research, right? Which means that there's a lot of people, a lot of money who believe in you and what you're doing. What do you think that says about the cause and the momentum behind it?
I think you're right. You don't get grant money unless you have something that people think is valuable and sustainable. So that is the good news. I think the challenge becomes, and we got a very big grant at one point, $12 million from the government. We thought this is going to be the end game. The government's paying for this. If we show value, they're going to turn around and say, okay, we're going to change legislation and policy to support pharmacists doing this work. At the end, they didn't, even though we had good results, because they said this was, in a sense, startup money for you to figure out how to sustain it yourselves. So I think in an optimistic view, yes, there's interest in supporting this work. The challenge remains that we, those of us involved in it, need to find those alignments with payers, with health systems that will allow this work to continue to sustain and scale up.
You know, I always like trying to make things relatable and understandable for people at home. I'm curious, bring it down to the street level. If there comes a day when pharmacists are federally recognized and supported, as you hope to achieve, how is that better for patients, for people?
Okay, that means that when a patient goes to see their provider for whatever chronic conditions they have, that provider can say, okay, we're struggling to get your diabetes, high blood pressure, asthma, you name it, under control. Well, we have a pharmacist that can help you do that. They'll spend time with you to make sure you understand your medications, how they help with your condition, make sure you don't run into side effects, adjust the doses for you so you get control of the disease in the end. That becomes a very viable and widespread practice that's available to patients. Simple example, in Washington State, they passed a law that allowed pharmacists to get paid in the outpatient setting for these services. They have since quadrupled the number of pharmacists that are practicing and partnering in medical clinics with physicians.
I'm curious, what are some of the next steps in policy change?
You know, it looks like what's coming next, at least for California, is something called a standard of care law. And what that means is if you look at nursing, medicine, their law is not all about each thing they can do, but it's about the scope of work that they're permitted to do, right? Kind of makes sense, right?
Yeah.
You can't itemize everything that they do,
Sure.
not possible. Well, guess what? Pharmacists' current law in California is a menu of what they can do specifically. So good example, pharmacists can immunize in outpatient pharmacies in California. If there's a new vaccine that comes in, well, they can't do that one because it's not on the current list of what they can do, which again, makes not much sense. Now that's slowly changing and evolving, but that was one that's sticking for a long time. So what we're trying to do, and when I say we, I mean faculty here at the USC Mann School of Pharmacy, California Pharmacists Association, other groups across the state, is push forward with a standard of care law for pharmacy. Basically saying, this is what a pharmacist does, a pharmacist practitioner does, right? So keeping it simple, not making it menu-based, that would make it so that it would allow us to do more clinical and collaborative practice without having to stop every time there's something new that comes up.
I'm curious, pharmacy laws, do they protect patients, and if so, in what way?
Yeah, good question. The Board of Pharmacy's primary responsibility is the safety of patients, simple as that. So when we talk about modifying laws, they need to look at it and say, okay, does this continue to put patient safety first? And they won't pass a law like the standard of care law I mentioned unless it does. And the good news is that they are supportive in principle of it. So end of the day, yes, absolutely do.
I know Desert Oasis Healthcare is ferociously passionate about pharmacy. They have this farm department, as you're well aware of. Yes.
Fantastic, yeah.
What are your thoughts on what they're doing to advance the cause?
They've been on this because of their great leadership. I think it's a combination of great pharmacy leadership and medical leadership that can see how team-based care is better for the patient and it's better for the outcomes of the organization. So they've always looked, I think, at gaps in healthcare quality. In other words, where are patients not being well controlled in various disease states or conditions, or where are we struggling with patients having side effects or major safety issues, and by sort of tackling that low-hanging fruit or the biggest issues, they've been able to show successes, and by showing those successes, create more opportunities for pharmacy. So I think they're a great example, really a role model example of what a best practice can look like.
Dr. Hoffing, it's been a really important conversation that we've had with quite a few medical professionals so far to help the community understand what pharmacists actually do, their role, because I think it's different than what a lot of people see or interact with every day. Why is it so important for the community to understand the role of pharmacy?
Well, the pharmacists add tremendous value to the patient's care. Primary care physicians have a lot on their plate, and they try to manage chronic disease patients, but a lot of times what happens in between visits without that pharmacist input and kind of monitoring to the patient and making sure they're taking the medications and understand their medications and are on the right medications, the patient would come back to the doctor, and those 2 or 3 months in between, there'd be kind of a degrading of the experience of their healthcare and kind of staying on their medications, and so it really adds a lot of value to the practice. For Desert Oasis Healthcare patients, if they're in a program with our clinical pharmacists, then they can get their pharmacist anytime they need to. They can call them, they can get answers to their questions. They can, if they're having a problem with a side effect or dosing or getting their medicine or paying for their medicine, they have somebody other than the physician to contact as part of that healthcare team.
The farm department here at Desert Oasis Healthcare, I know the team's extremely proud of it. I understand it's very unique. What do you think is so special about what DOHC is doing in the pharmacy space?
Well, we use pharmacists to the height of their licensure. And so we are able to have pharmacists really participating right there with the physicians in terms of making sure the patients are getting the care they need. And they just have much more time. We give them more time to take care of the patients and help the patients understand and learn about their disease and learn about the medications they're taking. So once they have that understanding, they tend to be more compliant on their medications. They tend to reach out when they have problems. And it just really lends itself to more complete care for the patient.
there's a lot of people who are dedicating a lot of their life to more allowances and medical freedoms for pharmacists. What do you hope to see grow and change?
Well, as a physician, sometimes you hear physicians feel like, well, pharmacists shouldn't be doing some of the things that they do in terms of providing healthcare. But when it comes to medications and chronic disease, I really think pharmacists should be valued even more highly. They should, in the world of fee-for-service medicine, pharmacists seeing patients should be a billable event for them, so that other than in managed care, where the way we practice, we can have pharmacists and do all of these things because of how we're reimbursed, but in the fee-for-service world, they really can't do a lot of this stuff because there's no way to get reimbursement for what the pharmacist does. So I think they really need to be able to become more autonomous, get paid for what they do, because they are adding so much value to patient care.
When you look ahead down the road at the future of pharmacy, you mentioned a bit of your hopes. Obviously, you're at the helm of this organization, not only renowned in the desert, but revered by members and patients as well. What do you see happening? Do you think your hopes, some of those changes are realistic? What do you see in the future? Crystal ball, pull out the crystal ball.
Hope is one thing. I mean, but change happens through the political process.
Sure.
That takes a lot of education. I think ultimately there'll be a realization, as there already is to a great extent, that there are not enough doctors to really take care of all the patients and their needs, especially as the population ages. There certainly aren't enough primary care physicians. And so I think there will be a political realization that to make sure patients get the care they need, that we need to elevate other healthcare professionals like pharmacists and advanced practice practitioners in status and in the way they're reimbursed, so that they can provide more care to patients.
Any goals for the future of the pharm department?
Absolutely. I think there's a myriad of disease states that we haven't touched on yet, that we're working on now, that impact the patients in our community. But also we're looking at being the stewards of AI coaching for health and wellness, weight management, to avoid those chronic diseases that we're currently managing. So how can we avoid those through the use of pharmacist interventions?
Fascinating and very smart that you're getting involved in AI, as we know that's not just the future anymore, it is the present. And lastly, before we go, your thoughts, given your expertise, goals for the future of pharmacy in general across America.
Yeah, absolutely. California is on the forefront of what pharmacists can do, from collaborative practice agreements to advanced practice licensure and certification. I think we'd really like to see that across the nation and have California be just one of 50 that does this on a regular basis, where pharmacists are really a visible, important, integral part of the healthcare team.
As they should be, right?
Yes.
Thank you.